Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 5th of July. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you.
In the United States yesterday on July 4th, we saw about 35,000 positive new cases. And while this is not representative of what's going on in the United States, as we are seeing a 10% increase over the last 14 days in cases, with a 7-day average peaking at about 105,000 positive new cases. The booster shot rate is still at about 31% in the United States, with hospitalizations increasing by 12% and deaths also increasing by 25%. In Illinois, we did not see any new cases yesterday as they were not taken, but we have a 7-day average of about 4,000 positive new cases, with death rate decreasing by 8% and the hospitalizations increasing by 1%. Okay, what can you tell us about this 7-day average in the United States still at like the same number for the last 3 weeks?
Well, remember the United States is just such a large country. There's a lot of movement. People move around quite a bit, but the regions do behave differently. So what you're seeing right now is not too dissimilar what is happening in Europe. Europe loosened up all their mitigations also at about just a little bit after we loosened them up. And they let the tourists come in. And so there's a lot of movement from people from all over the place. And so they're seeing the cases go up too. France in particular is seeing a big jump in their hospitalization rate. Not so much the death rate, similar to here, but the hospitalization rate has jumped up there. So, and they're talking about bringing the mitigations back, which is the same thing that some of the states are talking about here, like California. And, some cities, in the United States, you have, over 80 different health departments that are making up their own rules. So it's kind of a mixed bag. So what's happening? So the governments, what it appears, are kind of unlikely to put a strong mandate in place. That looks like it's just not going to happen. Especially if the death rate stays reasonably low. Now, remember, a couple of weeks ago, we were talking about a little over 300 deaths per day. Now it's pushing up towards 400. So that's, that's a big increase. It could be as much as 30%. And, if that keeps going, we're going to have to do something a little bit more drastic. But we'll see what happens. People are protected with the vaccines, and we really need to push the vaccines and the boosters. The United States has a very low booster rate, and there's a definite benefit to taking the original 2 shots. Then the booster helps, and the double booster helps even more. And if you had COVID, that helps. That even adds to it. So that's keeping the death rate kind of down. Plus Paxlovid, the drug. So if you get infected, if you're high risk and over 50, or over 50, you should be taking Paxlovid. So you put all that together, and the serious disease is not as bad. Let's put it that way. So, and it varies around the country. So Illinois is looking good right now, but other places are taking off. So we'll see.
Very true. Well, expanding out of the United States, the first big headline is that Thailand ends almost all travel restrictions to entering Thailand, but one key rule remains. What can you tell us about this one key rule remains versus why it's important to all of the others that have been dropped?
Well, Thailand has had, I would say, kind of an unusual health policy for COVID. Sometimes overly strict, putting people in quarantine that come in, for 1 to 2 weeks in hotels that the government controls, and that just shut off travel to Thailand. People didn't, it was just not worth it to go into quarantine for up to 2 weeks in some cases, and then do business or be a tourist or whatever, and then leave. So of course it's been devastating to their tourist economy, and they have an enormous tourist industry there. They have all sorts of industry, but tourism is big, and so it just killed it. So finally somebody said, I think we need to have a little more rational approach, like other countries. And so now you just have to have a proof of vaccination. And I don't know the details about how many vaccines you had to have had, but and then or show a recent negative test. So kind of like many other countries today. And so, that will loosen things up for Thailand a lot, because they were really pretty much tuned out of international travel for a long time.
Yeah, absolutely. And then our second big headline is that the FDA advisors recommended updating boosters targeting the various subvariants of Omicron.
Yeah.
What can you tell us about what's going to go on in the fall?
Well, everyone's been talking about this for a couple months now, that like with flu shots, which change every year, these COVID shots are also going to change periodically. Might not be as seasonal as the flu, but it's going to change periodically. So the most recent plans that have been at least published in the press with quotes from the different companies was that the vaccine would likely be, half of the vaccine would be the old vaccine, and half of the vaccine would be kind of engineered for the Omicron variant. Now, Omicron has a bunch of variants, including these newer ones, which are over, like you mentioned, 50% of the population is getting BA4 and 5, which is even more contagious than the original BA2 and the original Omicron. So what the advisory panel here has, and they only can recommend, they don't have authority, but the FDA has authority, and they have strongly recommended that the mixture that comes out this fall, which they're saying now is in October, should be the old vaccine and a vaccine that's been engineered to protect you from BA4 and 5, because it's so different and so much more contagious. So that's a recommendation. It's likely to happen.
Yeah. Well, going into our first
But the other thing is,
yeah,
we don't want to, people shouldn't really be waiting for this to happen. A lot of people are saying, oh, I'm going to just wait till October. Well, July, August, September, 3, maybe 4 months, it might be 5 months. That's a long time to wait in COVID land. And it's probably better to be up to date with your boosters now. When the new variant comes up, you can take the new vaccine. I don't know what they're going to recommend. It's either 4, 5, or 6 months after your last booster. So it's probably better to do both. Take one now and take one later.
Yeah, no, absolutely.
Most common question I get.
Yeah. And now for our first big COVID question. This individual says, I've been wearing 2 medical surgical masks in between 2 shirt/cloth masks with an elastic that push the medical mask flat against my face. Should I switch to an N95? I also wear my glasses in public. What can you tell this individual about what mask they should be wearing, Dr. Murphy?
Yeah, well, the masks, all masks offer you protection. Now, some masks give you more protection. So the best protection is with the N95 or KN95. If it's very snug, it's very difficult to wear for any kind of period of time because it is so snug. It's like hard to breathe. It's just uncomfortable. You can breathe, but it's uncomfortable. So they're not practical on a long-term basis. But if you have to be someplace where it's a very high risk, for a relatively short period of time, that's the best thing. Now, putting the surgical mask on helps. If everybody's wearing a surgical mask, that helps even more. Putting 2 surgical masks on helps even more than just wearing 1 surgical mask. And what this person is doing, I've never heard of anybody doing that, but 2 surgical masks and 2 cloth masks probably works even better. I would say that I've never recommended that, but 2 surgical masks, whether or not you put in the cloth ones, they're probably not doing too much. 2 surgical masks is pretty good. And it's at least it's practical. You can breathe, especially if you're wearing glasses, they tend to fog up your glasses and stuff. So I would say on a practical level, the 2 surgical masks are really very good and very protective. K95 when you absolutely need it or super high risk.
Wonderful. And then going along with this, our second question is, if you are standing outside unmasked, is there any risk speaking to someone if they are at a normal social distance, which I would say is about 3 feet, Dr. Murphy? What would you say to people who are questioning outside activities right now?
Yeah, well, the original mask data has been reviewed and published, and it appears that 3 feet offers significant protection. It's less than 3 feet that puts you at the highest risk. Now, you get more protection if you're at 6 feet. You'd get even more protection if you were 100 feet. Come on, let's face it. But 3 feet is the minimum. And so now the COVID Omicron BA4 and 5 is really, really contagious. So, that's kind of the problem right now. But 3 feet does give you some protection, particularly if you're outside.
Wonderful. And now for our last COVID question. This is a question I feel like Dr. Murphy, you have answered so many times on here, but it says, Dr. Murphy, I'm always hearing that getting vaccinated protects people around you, but I don't understand how that works. I am fully vaccinated and boosted, and I have friends that are not and want the facts. I can relay them.
Yeah.
Okay, Dr. Murphy, why is getting vaccinated important for other people, and why is it important for you?
No, it's a very common question I get, and it's a very important question. So it's a good question. I don't mind that people ask me this every day, because the message really has to get out there. From a public health perspective, the more people that wear masks, the more people that are boosted and vaccinated, the better. And each, like I said before, each level, like the first 2 shots, 1 booster, 2 boosters, as you go up the chain there, you get even more protection. Now, so how it works from the public health side is that, say you had your 2 booster shots, you are much more unlikely to get infected yourself. And so you're protecting the people around you. I mean, look at it this way. Would you want to go into an enclosed venue, a restaurant, a theater, if everybody in that room had been double boosted, or if half the people had not received the vaccine at all? The answer is clear, that you want to be around people who are up to date with their vaccines during a pandemic, which we are. So that's why you protect the other people around you. So it's a public health approach, and public health is very different from individual health. People say, I don't need it, I don't care if I get infected. I mean, okay, that's individual health. That isn't, and it doesn't help us on the public health side if you want to protect everybody, or as many people as possible. And so that's why you want to be boosted, vaccinated, boosted, and double boosted if you're eligible for that. And you'll protect everyone. So the more people that do that, the better they are for society as a whole.
Wonderful. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy, and we'll see you next week.
All right. See you next week. And I think we're scheduled also for Friday on WGN at approximately 7:05 a.m.
Wonderful. Well, tune in, everyone. Thank you.